OK, well, Niall Dickson is Chief Executive of the NHS Confederation. Neil, good morning to you.
Good morning.
What do we make about the testing and how many people are going to be tested? It's obviously a move in the right direction, but it is late, is it not?
Yeah, I think it probably is later, certainly later than we would have hoped. I think there have been some logistical problems with the so-called reagents which make the test. But, you know, I think we probably should have acted sooner. But as you were saying earlier, I think this is probably not time for blame game. We really do welcome the fact, because I think the key point is that if you don't have testing for staff in place, that increases concern and fear among staff. It keeps people away from work, which is absolutely critical at the moment. We need every frontline worker that we possibly can. And I think ramping up testing for staff in this way is absolutely vital in getting them back to work. I should say the antibody test, which, again, we're not quite clear when that will come in, but that will be literally millions arriving, and that will be something you can do yourself. That will be something that, again, must be a priority. They have said it will be a priority for NHS and care staff, and that means you can test whether you've had the virus or not. And if you've had the virus, the chances of you getting it again are pretty remote. So that is, again, really important that we get that, and that should be a game changer. So I think we should be going up. I understand we're around, in England, around 9,000.
Yeah.
We'll have capacity for around 9,000 a day. It should go up to 25,000 a day. And we have been talking about that behind the scenes. People saying we should be able to get up to 25,000 in the next 2 or 3 weeks. So we'll have to see whether they can do that.
Well, look, I don't know where these things come from. I don't know who makes them. I don't know how much they cost. But whose fault was this, that this has not been done quickly enough? And I'm not particularly interested at all in blame game. I take your point. But many people are criticising the government. A lot of people who support the government are saying, well, the NHS forward purchasers and procurement officers should have been way on top of this.
Yes, I think it's very easy. I mean, I just don't know that people... We had planned for a pandemic, and there's no doubt, I think, that the planning for that pandemic has demonstrated things that we should have known, or well, maybe things that we certainly could have done better, and probably the time to do that is afterwards. You know, it's a bit like saying, as you were saying, you know, the Prime Minister shouldn't have been so close to somebody or whatever else. I think the moment now is to say, are you doing the right thing now? And we will be able to know, should we have done lockdown earlier? I simply don't know the answer to that question. And I'm not sure those who criticise really know, because we know that the consequence of lockdown is very significant, not just for the economy, but also for actually very vulnerable people, for abused children, for domestic violence, for people who have mental health problems.
Yeah, and the behavioural psychologists were saying if you go too early, people will come out of this, they won't observe the social distancing, they won't follow the rules, they won't adhere to social distancing. So, you know, the behavioural psychologist aspect of this, I mean, all of this is going to get looked into after the case, Neil, but after the fact. Just on the antigen, I keep hearing antigen testing and antibody testing. I don't want to get sort of too hung up on a biological question, but what's the difference?
So the antigen test, and I'm not a clinician, but the antigen test is about testing whether you have the virus. The antibody testing is testing whether you've had it. And it seems as if the new test, the antibody test, the one, have I had it or have I not, is going to be much easier to administer, and they will have millions of it, sort of almost not...
sorry, which one's that? The antibody testing?
The antibody test.
Oh, okay, fine. Yeah. And is that like a blood test that you do on yourself? Is that the way that's going to be?
As I understand it, it's something you can do yourself. It'll arrive in it could be delivered by Amazon or the like. The important point for the NHS and for my members is whatever we get, the priority has to be for NHS and for care staff, because they're the ones they're our frontline troops. Yeah. And we need them, and therefore you have to give them that test if they have had something, or one of their relatives or whatever, to make them clear whether they've had it or not. And because this is sometimes for quite a lot of people, quite a mild illness, especially if they're younger, then they may not know whether they've had it or not.
Can you get it twice in quick order? In other words, the antibody test, the test which determines whether you've had it or not, if you get that, whenever that may be, and it turns out that you have had the coronavirus, will you not be able to pick up coronavirus again?
You're Now, I'm not a clinician, so
I know.
I was caveat that. I am told you're very unlikely to have it. That said, no test is 100% accurate, so there will always be false negatives, false positives in these things. But generally speaking, if you've had the test and it shows that you've had the virus, then you're pretty likely to be, or very likely to be, immune from getting it again. At least for the short term.
And Neil, and the antigen test, the one that says do you have it or you don't have it, that one, will that have to be done by frontline staff on a daily basis? Because you may not have it today, but you may have it tomorrow.
Well, I think that's a really good point, and the answer is, as far as I know, we would never have the capacity to be able to test 1 million people every day before they go to work. And remember, the NHS is 1 in 50 people. So the answer is, again, this would be targeted at people who are in danger of having to self-isolate, or who are in danger of having to be off work, and then enabling us to know whether they've got it or they haven't. So I think, again, it would be targeted, my guess, rather than a blanket thing put on to everybody.
Listen, I much appreciate your time. Any good news, Neil? I mean, this is...
Yeah, I think there might be. I think, London in particular is really bracing itself at the moment. But I think the possible good news is that on the modelling, and nobody can be absolutely sure whether this is right, at the moment, we're still at the first area of surge. It is possible, not definite, that we will manage through this first area of surge without the system, being so overstretched that it can't cope. We don't know that, but, I think there's some view that we may not be in the worst possible state.
Well, thank you so much for your time this morning. Niall Dickson, Chief Executive of the NHS Confederation.